Okay. Can the basketball spin itself? It's way too early for that. I can't believe. Philosopher, Velociraptor. So the basketball can spin, obviously, right? We could spin it, and we can spin it in three planes. We can go sagittal, we could go frontal, and we could go, let's see, I haven't done this in a long time, but we could do it with transverse, right? So we can spin the basketball in three planes. There's two ways to spin the basketball in each plane. I could spin it this way or spin it that way. So there's 6 possible ways I could spin the basketball. So far, so bad? All right. So the basketball can't spin itself. It can spin. Okay, that's possession. All right. Demons out. The basketball has the potential to spin, but it can't spin itself. Something has to make the basketball spin. Primarily it's us, right? And so the analogy with the basketball is going to serve as a representation of our pelvic pelvis. Okay. So this area that's known affectionately as the pelvic girdle is just a series of different articulations, joints. Some of them move significantly, like the hip, but the pubic symphysis, not enough for significant motion. That's what we call an amphiarthrotic joint. A little bit of play so we don't keep breaking our pubic symphysis. Our sacroiliac joint, y'all ever heard of the SI joint maybe? And okay. Little bit of play, not enough to cause significant motion. So in other words, this is literally similar to this. I mean, there's a right side of the basketball, left side of the basketball, the front and the back. But the pelvis can sit to this basketball, but it can't spin itself. Something has to be able to spin it. For the lecture today, I'm going to show you how we spin the basketball with our hips on the bottom. But we can also palm the basketball and spin it with our trunk from the top. We'll get there eventually. But today it's important to see how we can make our basketball spin in its sagittal. We can make the basketball spin in the frontal, and we can make the basketball spin in the transverse. Now, the spin of the basketball, how the basketball, because remember, everything's about perspective, global, local, joints perspective. The basketball has a perspective. No matter what was responsible for spinning it, basketball can spin. And so the basketball, we can give it backspin. We could give it forward spin. Where my basketball players at, just casually. Right? When I used to play, I used to go to children's camps, and we would do like funny things where the kids were, and we would spin the ball, right? And so it would go to the left of the kid, and right? We would do that. I think that the carpet absorbs too much energy, and I'm getting old. Do you remember what I'm talking about, where we would give it spin, and we'd spin the ball, and the ball would go the other way, and the kids would think we were wizards, right? They didn't know any different. So we can spin the basketball. How does the basketball spin? Is from the perspective of the basketball. What spun the basketball was the perspective of my hands. How I choose to spin, forward spin, back spin, side spin to the right, side spin to the left, or spinning it transversely one way or the other. Okay. So the pelvic girdle has a perspective of spin. And the reason it's important is for physical therapy, occupational therapy, coaching, fitness training. It's a heck of a lot easier to communicate pelvic girdle spins than having to sit here and say, well, bilaterally extend the hip, simultaneously flexing the trunk, or left hip adduct, right hip abduct, left lateral trunk bend. Like it gets verbally big. In addition, the basketball doesn't have to spin because of both of my hands. I can be standing on one hand and still make the basketball spin. So in other words, my basketball, my pelvis could have been spun by my right hip or my left hip or both hips. So for this lecture, we need to separate pelvic girdle rotations into two separate main questions. Is our basketball spinning? Is our pelvic girdle spinning? And if the answer is yes, well, then if the answer is no, then we're done. If the answer is yes, we have to ask, how did it spin? What spun it? What was responsible for spinning the ball? Was it both hands? Was it just my right? Was it just my left? That's where we get into hip motion. So I'll give you an example. I'm going to give you a lot of examples because this is some weird stuff. That's not weird, but hopefully it'll make sense of some of the pelvic floor and pelvic exercises that we do, especially tilts and that kind of stuff. So when we did the right hip flexion, the illusion, notice how my basketball spun anteriorly. It spun forward as if I was giving it front spin. That makes sense? And we're going to have a name for that kind of spin. Coming back up, the basketball would have backspin. First one to have, like in other words, if I kept spinning, wouldn't my basketball and my pelvis want to roll forward? And if I kept spinning, it would want to roll back. Okay. That doesn't change the fact that we have right hip motion, flexion, extension. That's just what spun the basketball, that is my pelvis. And again, the reason we have to look at the pelvic girdle as one unit is because my right side and my left side are connected together. Cervical, thoracic, lumbar, sacral vertebra, remember those that fuse? As this is like bedrock. This is the skyscraper built upon the bedrock. So in other words, I think I mentioned this last class, I can independently move my shoulder girdle right from left. They don't have to move together. But when I'm moving the pelvic girdle, if I move the right side of my pelvis, the left side has to go along for the ride. I can't, it would be like cracking a shell if the left and right could move independent. They have to go along for the ride. So the whole pelvis has to spin when one side spins. Let me give you another example outside of basketball. So nothing but the best props. And this morning I woke up super early. I was at the store really early to buy balloons just for this class. So again, this is an analogy. Here's my pelvis. I think in your notes I have the penguin in the pelvis. Does it kind of look like a penguin? Little things that get to me. And my youngest son loves penguins. So here's the pelvis. Notice the arrows. I can spin sagittally in two different ways. Notice the side arrows. I can spin frontally in two different ways. And then notice the transverse arrows. I can spin transversely in two different ways. Did it spin? Yes or no? If yes, how did it spin? That's when we get to the joint motions. My pelvis spun because of my right hip. My pelvis spun because of my left hip. My pelvis spun because of both hips. And eventually, when we move up the chain, you're going to see how my pelvis can spin just because of trunk. That would be getting old, but I'll try it. Kelly Clarkson. My pelvis has spin because of trunk. My pelvis had spin because of trunk. some examples, right, before we get into the specs. All right. Up until this time, we have had appendicular motion appendages. You have two of them. So our communication of motion is the side, right or left. The joint, we analyze motion joint by joint, ankle, knee, hip, subtalar. And then the motion of that specific joint on that specific side. The basketball, since it's one unit, in other words, it doesn't have appendages. I can't move just the right side of the ball without the left moving as well, right? So the verbiage of what we have one of is a little different. Similar, but a little different. We only have one cervical spine. It has a right side and it has a left side. But there's only one slinky here. There's only one slinky here. Bigger slinky, but it has a right side, it has a left side. There's only one slinky. Remember, guys, I have a right arm, but the side of my side is what's lateral and medial. And I have a left arm. So when we're talking about things we only have one of, pelvis, eventually we'll get to the trunk and the cervical, rights and lefts now have a little bit of different meaning. Right and left doesn't literally mean my right arm or my left arm. Right and lefts help us to say, how are we spinning? Am I doing a cartwheel to my right? Or am I doing a cartwheel to my left? To the right, to the left. Now did they be trying to cool? That song's probably getting too old to use that bad joke. So right and left can mean two different things in two different planes. I can do, and guys, let's try not to make it as complicated as it is, because it's not. You can do a front roll or a back roll. That's sagittal. You can do a cartwheel to your right or a cartwheel to your left. That's frontal. And you can spin to your right or spin to your left. That's transverse. Those are the 6 options. All we got to do is give them names. So, cartwheel to your right. Wouldn't it be like this kind of spin? We call that right to the right, lateral to the side, pelvic girdle rotation. So, frontal plane spins of our basketball, that is our pelvis. We have right lateral pelvic girdle rotation as an option and left lateral pelvic girdle rotation as an option. Let's check your understanding. Because I think, especially the students that are here Monday, Wednesday, Friday, they're up on the information. Not to say people at home aren't, but I can't check your facials when I ask these questions. When I'm standing in anatomical, what type of hip motion do you think would be responsible for the frontal plane pelvic girdle rotations? True. What joint motions do we have in that hip's frontal plane? Ab and ad. Yeah, good. Ab and ad. What's moving the basketball? Abs and ads. So when my pelvis does a cartwheel to the right, like think about it, guys. If my pelvis wasn't attached, let's do a thought experiment. It's spinning to my right. Make sense? Because of left hip ad and right hip ad. That's what spun it. That's how it spun. Right lateral pelvic girdle spin because my hip joints spun it that way. Just like I was giving it spin here or there. That's all it is. My hips made my pelvis spin right lateral. Specifically, left ad, right ad. Let's spin the other way. Left lateral spin, right? Left lateral pelvic girdle rotation. Now, here's an illusion. Rotations versus translations. We communicate joint motions because of the spin, not because of a shift. Let me explain. If I give the ball left lateral spin, it doesn't matter that the ball shifts to my right. It's still spinning to my left. Does that make any kind of sense whatsoever? Because what's going to happen is your brains have only been taught linear world. So when we do shifts, I'm shifting to my left. But that's linear. The spin to the right. We're going to get there. In fact, what I'll do is after I'm done with the spin, I'll let you talk about the more. Love it. You're good. You're good. You're doing your job. Watch it again. I might have shifted to my right, but the spin is to the left. True or false? This going down or this coming up is the same spin. Same spin. This coming down or this coming up is the same spin. Right lateral spin. Left lateral spin. Right lateral spin. Left lateral spin. Good? Okay? Right and left can mean two different things in two different planes. Right and left has nothing to. Right and left means nothing in the sagittal plane. In other words, a front roll and a back roll, there's nothing right or left about it. It's like on that. It's on the line. Sit in the fence. However, I could do a cartwheel to my right, cartwheel to the left, and I could spin to the right and I could spin to the left. So let's look at transverse spin of the pelvic girdle, and I want you to tell me which hip motions would have to spin basketball. Basketball, I am spinning my pelvis to its right. We call that right transverse pelvic girdle rotation. Or in this case, I'm spinning my pelvis to my left. Spin to your right. Spin to your left. Right and left transverse. So right and left lateral or frontal plane spins. Right and left transverse or transverse plane spins. And the final one is the front roll and the back roll. That's anterior spin. If I spun the basketball, it would want to roll forward. And if I gave it back spin, that would be posterior spin. It would want to roll back. So this is what would happen in the sagittal. Anterior, posterior. And I'll do the basketball too. Anterior, posterior. How many of you guys in the clinic, in the literature, the neuroscience, you've ever heard of tilt, like anterior tilt or posterior tilt? Sway back. Anybody ever heard of someone who has a sway back? That's because their pelvis is tilted anteriorly. It's anterior tilt. And Lindsay's going to talk about a different way to see the pelvic girdle rotations based off of pour instead of spin. I like to introduce different ways to see it because some of you may be like, I get spin. Some of you may see it, I get pour. Your team pour, right? P-O-U-R. All right, so let's do the final practice of concept. Is the pelvis spinning? Yes. How is it spinning? Because of hip motion. What specific hip motions? Ab and adductions. When I have left lateral, in this case, my right hip adducted and my left hip adducted. That's the only way I was able to make the basketball do this. right lateral because of left hip add, right hip add. Now, I could just do it because of one leg. In fact, practically speaking, you guys do this all the time. And that's why seeing these pelvic girdle rotations is important. When you're walking, you're constantly manipulating your pelvis. You weight bear on your right leg, you need to hike up that left hip so that you could swing through and not stub your toe. You're giving your pelvis lateral rotation as you bring it up. I'm exaggerating it, obviously. You give yourself transverse pelvic girdle rotation every time you take a step. Now, obviously, my trunk cancels it out and my hip cancels it out, so it looks like I'm going forward, which I am. We rotate to translate. But if you think about it, my left socket is further out in front than my right. And the only way that could have happened is if I did this. So that's why it's important to see these tilts and these rotations. Guys, the pelvis is very important to our motion because it connects our lower extremity movement with our upper extremity function. And the fact that it transitions between a stable bedrock for us to build upon, and also we can move that bedrock around, would be pretty impressive. Okay. So I'm going to finish up with the spin, and then I'm going to let Lindsay talk about the pour. Anterior and posterior. What hip motions do you think those spins are going to be because of? Sagittal. Which specific motions we had at the hips and the sagittal? Absolutely. So anterior pelvic girdle rotation in this case because of bilateral hip flexion, and posterior because of bilateral hip extension. But I could have spun the basketball with just one hand. I could have had anterior because of just right hip flexion and posterior because of right hip extension. In terms of the pelvis, it doesn't matter. Is it spinning? In other words, if I spin it because of my right hip, that doesn't add any verbiage to the pelvic spin. I don't say right lateral or right anterior. Is the pelvis spinning? Is it spinning? If so, how? Anterior, posterior, right, left lateral, right, left transverse. What spun it? How did it spin? What did it spin about? Right hip this, left hip this, both hips that. You got to practice. All right, Lindsay, come talk to him about the pour. Practice on.
So for the pelvis, if you're kind of like, is that really motion? If I can't really tell, I like to think of a big old bucket filled with water, and so like once it's filled with water, if it tilts, that water's gonna pour out because it's so high up, it's so full. It's gonna pour out, and whichever way that water pours out, that's what motion you had. So that would be like your right pelvic tilt or anterior pelvic tilt. So that's what I like to do. If you see, like, make sure, and just to see if there is movement. Yeah. So like I have my little pelvis here, and so if it's full up to the top of water, and I tilt over, because this is going to be here all the time. No matter where I am, it's always going to be where my pelvis is. And then tilting over, the water's going to pour straight out this way. And the spin, or the tilt, is...
The tilt is position for help. Spin or rotation is the motion, the actual spin. So in other words, if Lindsay is anteriorly tilted, her pelvis is going to be looking at the floor. It's going to be constantly pouring water out front because it's not where it's supposed to be. Does that make sense? And you may be working with clients and patients that you notice, oh wow, their pelvis is tilted. Their pelvis is not where it should be. And a lot of times we don't notice these bad postures Well, I say we, I'm not included now. Because you're young, you're energetic, you're athletic, you're in shape. But as we get older, some of these bad postures start manifesting themselves. Okay, do the side forward.
So if I were to tilt over, or I guess like even if I just went to walk, and kind of tilt over, and even just ever so slight movement, that water's going to pour out somewhere. So that's how you always know if there's motion, that water's pouring out.
One more thing, if you go anterior, so water's pouring out. Posterior, just remember, it doesn't necessarily mean she has to pour water out the backside, it's just the spin. So if she anteriorly rotates and water's pouring out the back, wouldn't posterior turn the water off? Like, wouldn't it stop the pour? Yeah. So posterior is just the spin, but I love the visualization of the pour because it might help you see, oh, I'm pouring water out the front, I'm pouring water out the side. The only thing that wouldn't pour would be like transverse.
Right, that one's low. Right.
Okay. Cool. Any questions? All right, let's do some more practice. Good job with the pour. All right, you guys, check this out. So now that football season is over, I played fantasy sports. Anybody play fantasy football? So and so now I'm in a fantasy taekwondo league. We have our draft next week, and then after that it's fantasy lumberjack season, which is like we go hard. So let's look at this. That makes me want to get a bag of ice. How is that possible? Well, I mean, obviously the cliche answer is she's very talented and worked very hard to get there. That's true. But let's take a look at the assist that her pelvis gives both of her hips. Okay. So, even if it's if my right shoulder is abducted to 90 degrees, okay, can I get my hand higher without moving my shoulder? Yeah, I can lean to the left and my arm goes up. Heck, I can do left lateral pelvic girdle rotation and my right arm goes up because it's a function of a first class lever. You don't even know that for the test, but it's basically a teeter totter. And with a teeter totter, when you bring one side down, the other side goes up. Physics doesn't have to be complicated because our brains already know the application of a lot of these fancy physics terms. So what I want you to notice is the same concept applies in our pelvis because they are connected. Because they are connected, when I, like a teeter-totter, except the fulcrum or the axis sitting in the middle, it's either on the right hip or the left hip. But when I bring my right side of my pelvis down, the other side goes up. And when I bring my left side down, the right side goes up. So if you notice, one of the reasons she can get her foot so high is her pelvis literally is leaning, helping to bring that other leg up. So that way her other hip abduction can summate with literally repositioning the socket. So if she started here and did this, I'm not even going to try it because I don't want anybody to have to call an ambulance. That would be very embarrassing. Frontal plane, she would have right lateral pelvic girdle rotation so that her left leg could get higher functionally up in the air. Now, she still had left hip abduction, but the reason, think of it like this, if her left hip stayed in that position, but her pelvis didn't tilt, she'd only be like right there. The fact that her pelvis laterally rotated allowed her foot to get that high. Make sense? We call it, and this is going to apply much more in our arms because we have a dexterity, but we have a term for it. It's called our functional circles of reach, where we use multiple joints to help us kind of function in a certain bubble. Think of it like this. If you were fixed, you could reach a certain amount to your right, a certain amount to your left, up, down. You kind of have this bubble of function. And one of the things that makes us extra unique is we have dexterity anywhere in our bubble. Now, we can move our bubble, but we have practical function in that bubble. So if this person wants to create a bigger bubble with their feet, we have to have ways to help reach certain places in that bubble. And our pelvis can help us with that. Our pelvis can rotate literally to reposition the whole joint so that you could reach up higher, reach out further. Sometimes it might be reach down lower. How many of you have ever... people don't really hang out at the mall anymore, I guess. That was kind of my day. But you when you go to the store, or heck, maybe at Mardi Gras parades or social gatherings, you ever just like people watch? Disney World's the best for that. And sometimes my wife has to like cry, and you're being obvious. I'm like, they have a really unique gait. But you see a lot of people that have unique walks. So think about someone who might be like throwing their hips when they walk, like on the runway or something. You'd be like, yeah. That's pelvic girdle rotations. Right lateral, left lateral, right lateral. That's what's happening. Pelvis spinning. What's it spinning about? Left hip add. Then my left hip's going to add so that I can get this right leg up off the ground so I don't hit myself. And then when I weight bear on my right, boom, left lateral because of right hip add. Ab, right lateral, boom. So when you see these uniquenesses with gait, pelvic girdle stuff happens. Okay, we're going to work on that. Let me get to the exception to the rule of poor. I love the poor, but there are exceptions that I just want you to be aware of. That's why I created the poor. But there are certain times where it's important to still see spin because I'll just explain it. So if we're doing full sit-ups, in other words, we don't start in an anatomical position or a global anatomical position. Let's see. So you can still use poor. However, you can't do it globally. Meaning, I have a saying, the pelvis is never lost. The pelvis is always in its anatomical position because it's not a joint. It's literally a cinder block. Okay? So if you wanted to do poor, you still can, but you have to realize, oh, I want to look at the pelvis as if the pelvis was in anatomical. And then I can see, oh, the pelvis is pouring anterior. But in the case of a full sit-up, if you see spin, then it's the same regardless. To me, that's kind of the one exception is when the pelvis isn't lined up, when the water isn't out here and you start here, or you start there, you still need to be able to see the spin. So coming up on a full sit-up, that's not all trunk. We're going to get to that. Your trunk really doesn't give you much, which makes sense. I mean, you got all vessels and nerves, and you can give some. The tree can sway, but if the tree sways too much, what's going to happen to the tree? All right, yeah. The tree's going to snap. So your tree can give some, but when you come up with a full sit-up, it's happening at your hips. Okay? So bottom to top, can you see that my pelvis would have anterior spin? Anterior pelvic girdle rotation as the person comes all the way up, and then posterior spin when the person goes down. In fact, we mentioned that anterior and posterior is like doing a front roll and a back roll. So if you accentuated, I'm not going to do it because I can't anymore. But if you came up and I kept spinning, spin forward and be anterior. And if I came back and I kept spinning, I would roll back. That'd be posterior spin. So how did the pelvis spin? Anterior pelvic girdle rotation. Because of what? Bilateral hip flexion in this case. How did the pelvis spin? Posterior pelvic girdle rotation. Because of what? Bilateral hip extension in this case. Y'all think y'all could handle some practice? Awesome. Let's do it. Here's how I want you to set up your questions. Yes or no? Did the pelvic girdle rotate? If the answer is yes, how? And by which means? Which hip motion? So we're on hip now. All right, here we go. Start. I'll show you why I do that. You got to shake the edge of sketch to start all over. Start. Finish. Some of you are going down the rabbit hole, and I appreciate it, and I love it. I was the same way. But all I want is the plane that had significant motion in it, right? So I don't want like, ooh, a little bit of this, and then a little bit of that. So I want the one that had the most motion in it. Just getting started, okay? So you ask yourself, did the pelvis spin? Did the basketball spin? Did the balloon spin? Did your cup of water spin? If yes, how did it spin? And what spun it? All right, I'm sorry, we got to go quick because I want to get a few in here. Did the pelvis rotate? Yes or no? Good. How? Right transverse. Awesome. Because of what? Because of left hip external rotation. Questions, clarifications? We're good? All right, how about this one? All right. Finish. I know it sounds silly, but the reason I shake the edge of sketch is because I want to be clear which phase I'm speaking about. Because if I go down and come back up, it might be which one is the asking coming up. So that's why I keep it silly. Shake the edge of sketch. Start, finish, shake the edge of sketch, come back, start, finish, shake the edge of sketch, come back, start, finish. As always, feel free to take pictures. I will be a silly goose as much as needed if it helps you learn. I don't know what it means, but my oldest son says I've risen with the tism. I guess it's a compliment. Trey, what was that? He's always talking about caps and on gods and stuff. Caps and no caps. All right, you guys. Did the pelvis rotate? If so, how? Anterior, outstanding. Because of what? My right hip flexion. Guys, think about this. And again, you know this. I feel like a movie well before your time, but on Friday. You know this, man. If I am weight bearing on my right leg, my left hip cannot bring my left hip cannot move my pelvis. Because if I say, hey, left hip, move my pelvis, my left hip's like, woo, I can't hold on to anything. I'm literally free falling. My left hip's like, dude, I can flex, I can extend, I can external, I can internal. But until my right hip extends, my pelvis isn't coming back. Does that make sense? That's an important concept that we're going to apply later on too. If you're applying force to something, you need one part that's anchored and fixed and then another part that can move. But if I'm on roller skates and I'm pulling on you on roller skates, we won't have a very efficient movement. Okay? All right, last one. Unless we have another one. Here we go. Start. Finish. Lindsay, everybody's afraid to move. Ain't that a shame? Zen 2 doesn't cause pain. Took me a while to get that. Usually quicker. Remember, we're asking, did the pelvis spin? If the answer is yes, how? And if the answer is yes, what spun it? Remember, the basketball cannot spin itself. Something has to spin it. We're practicing hips. Eventually, we'll get into how the basketball can spin because we're palming it on the top. That's going to be trunk. It's like if you're in your swivel chair, you notice how you could swivel your pelvis if you keep your hands fixed? That's because of your trunk motion. You notice the first time you've ever seen me wear tennis shoes in here? Did you notice that? I've been going to rehab for my foot, and so it's like, dude, you gotta start trying. I was like, try. I have PTSD, pediatric trauma. So it's almost like I'm just waiting to feel it, but I need to be positive. All right, you guys. Did the pelvis rotate?
Yes.
How? Outstanding. Because of what? Left internal, right external. Left internal, right external. I'm telling you, this is confusing, but I'm trying to tell you why. Because when we move the small piece about the big piece, your brain wants to account for anything that spins that way as lateral. But if the socket moves about the ball, they'll have the same rotation, but opposite spins. It has to be. It has to be. Yes, because friction. I could do it, and that's why I started off with the other one. I could do it just because of one, but I'd literally have to lift it off of the ground because friction is preventing me from. There is a little bit of rotation that coincides with your subtalar joint. So there's a little bit of play that can work. We call it a miter hinge, but where your transverse here through your subtalar and transverse can segue into frontal there, but it's not significant. I can't do this with my feet off the ground because of friction. Friction's preventing that. All right, I lied. Last one. Bringing it all together. Uh-oh. I'm making it easier than what it could be because I'm literally moving my trunk with it so that you can see it easy. Eventually, we're going to get it to where I can move my pelvis and my trunk also moves to counter it, and it may not look as easy. But I'm going to teach you how to see the clues in the clothing. In other words, my trunk's going to bend back and recurve the other way to keep my shoulders low. So that's coming. But can we see this pelvic girdle rotation? I'm telling you it happened. And then the harder part, but this is a callback. We did this. That's why we do it in little bites. The pelvic girdle rotation, I'm giving you some information. Pelvic girdle spun, check. It's spun because of left and right hip motion, check. But the left and right hip motion were not the same motion. That's what I'm seeing if you can think about it with your voices in your head or your neighbor. Lindsay, how did you do the full sit up? And again, you still can do it. You just have to make sure that the pelvis is always level how you look at it, and then you can visually see it more. Absolutely. But I love the pour because it gives you a visual of what's happening. Oh, I'm pouring water up front. Yeah, absolutely. I love that analogy. All right, guys, I'm going to make today count because I'm not going to see y'all for a week. Give me tears. All right, here we go. Left lateral pelvic girdle rotation. Because of left hip ab and right hip external rotation. How would I have to rotate my right hip to go back home to line up with the pelvis? Because the pelvis is never lost. I'd have to internally rotate it to go back home. Therefore, I had to externally rotate it when I left. That was the example we had the other day. I could also do left transverse because of left hip internal, right hip horizontal ab. I could do right transverse because right hip horizontal ab, left hip external. Guys, I know this might seem kind of overwhelming, just like anything else. It comes with practice. And on a positive note, my students, hearing from so many former students who are in grad school, PT school, OT school, DC school, personal trainers, they are teaching their other peers this stuff because they've never had this before. It's going to make it better. I promise you. All right, guys, you have a safe break.